Hi, everyone. Welcome to MedEnt Minutes, the podcast that explores EHR optimization and how practices can excel in value based care. I'm Megan Chapman, the Director of Marketing and Communications here at MedEnt, and today we are discussing chronic care management with Dave Gamer, the President of MDSS. And Dave, thank you so much for coming on our podcast. We really appreciate having you on today.
Thank you for inviting me.
Yeah, so, before we get started, I just wanted to say, can you tell me a little bit about MDSS and its mission in chronic care management?
Sure. Well, MDSS is a company dedicated to improving the lives of individuals living with chronic conditions through our comprehensive chronic care management services program. Our mission is to empower patients so they can actively manage their health, improve their overall well-being, and reduce the burden of their chronic illnesses. We strive to provide personalized support and guidance, making sure that patients have the resources and knowledge they need to achieve their health goals. And MDSS's objective is to make healthcare more personal, proactive, and accessible for patients living with chronic conditions, and bridging the gap between patients and providers by offering high quality, ongoing care management. We believe that no one should feel alone in their health journey, and our team closely works with patients to ensure they get the support and education and resources they need to improve their quality of life.
Fantastic. And now, what inspired you to enter the, CCM space? And can you tell me how that journey has evolved? How long have you been doing this?
Sure. Well, we got started in 2018. We were asked by a client to look into a program called Chronic Care Management offered by CMS Medicare. We knew nothing about it, but we started to do the research. And in our research, we had conversations with professionals as well as with family, friends, and clients, and opened our eyes pretty quickly as we learned how many people were struggling to manage their own health between doctor's visits, which often led to otherwise unnecessary hospitalizations or worsening conditions. It wasn't too hard for us to conclude that offering CCM services to practices would be a win-win for everyone. It's good for the patient, the providers, the practice as a whole, MDSS, of course, and CMS Medicare. Everyone benefits. Since starting the space, MDSS has evolved from implementing CCM from a small one doctor practice to providing CCM services to medical practices from 1 to 20 providers. We also provide services throughout the U.S. for rural health clinics, community health centers, and even tribal health clinics.
Oh, wow. Great. Now, what are these core services that your company provides for patients with chronic conditions and, practices trying to manage that?
Well, yeah, we offer comprehensive chronic care management services. Essentially, we act as an extension of the physician's office, ensuring that patients receive the ongoing attention they need between appointments. We do this by providing personalized monthly care coordination from our call center in Michigan. Our team there provides an extra set of eyes and ears for the practice on their chronic patients by calling patients at an agreed to time each month. All our calls are recorded for compliance reasons. We provide 24 by 7 access to a dedicated care team member for support, questions, and guidance. And that's really a requirement of CMS anyway, so that's something we provide. We provide medication management and adherence support. And some clients utilize our remote patient monitoring services as an option where MDSS can provide devices for patients to perform convenient self-testing from home. We provide resource and education on disease management, healthy lifestyle choices, and self-care techniques. What we don't provide, though, is we don't provide medical decision making. That remains the responsibility of the patient's trusted provider.
Okay, great. This might sound silly and might seem like a simple question, but just, why do chronic care management with MDSS? Like, what makes you guys stand out?
That's the best question yet. uh, what sets MDSS apart, I think, is really our hands-on, relationship-driven approach. We just don't check boxes. We truly get to know our patients and tailor our care to their unique needs. Having the same care coordinator work with the patient month in and month out. Plus, our deep experience in CCM allows us to make the process seamless for healthcare providers as we handle everything from program implementation to compliance. And to give a bit more detail, MDSS offers a personalized approach. We understand each patient is unique. We tailor services to meet each patient's individual needs. We have an experienced team. Our team of registered nurses and care coordinators are hardly skilled and believe in providing compassionate care. And we're focused on patient empowerment. We equip our patients or even their family members with the knowledge and tools they need to actively participate in their care. And these services have shown to improve patient outcomes, reduce hospital readmissions, and enhance the quality of life.
Yeah, and just going off of that, are there some examples of that you could provide? How does it improve patient outcomes and quality of life?
Well, the impact is huge. Studies show that the CCM reduces hospitalizations, ER visits, and overall healthcare costs, as I mentioned earlier, while improving medication adherence and patient engagement. But beyond the numbers, I think the real benefit is peace of mind. Patients feel supported, they feel heard, and empowered to take control of their own health. And that's life changing, and that results in improved patient satisfaction.
Yeah, I mean, sure. I mean, even as a patient myself, I might have a chronic care condition, but if I did, it certainly would be so beneficial and to feel that support. It just kind of goes that extra step of really, helping people who have these chronic conditions and just kind of need that, extra time. I think that's huge. And I think CCM certainly has been revolutionizing healthcare for a while now. Now, we've talked about how it improves, but what are some of the biggest challenges that patients face in managing chronic conditions? And how does CCM and MDSS address those challenges?
Well, one of the biggest challenges, Megan, is consistency. Many patients struggle with medication management, keeping up with doctor visits, or even just knowing who to call when they have concerns. Isolation and lack of access to resources also play a pretty big role for patients. CCM helps by providing a dedicated care team member that patients can turn to anytime and feel connected with. We simply we simplify their care, we keep them on track, and connect with them the resources necessary to address the social, financial, and/or logistical barriers. And as important, MDSS can facilitate the communication and care between the patient's various providers, which, as you can imagine, is somewhat challenging as well.
Yeah. Now, I do have a question about, how long has MDSS been partnering with MedEnt for CCM? And can you tell us a little bit about what the partnership looks like?
Working with MedEnt has been an absolute pleasure. It's become not just a partnership, but a friendship. We've been working with MedEnt for about 2.5 years, and it's been fantastic. I don't want us to make this sound too loaded, but we really love MedEnt. They've been wonderful working with us. MDSS's care team uses MedEnt's own CCM module to post patient feedback each month right into MedEnt. As a result, providers have the ability to review patients' progress very easily because they avoid the need to jump to a third-party CCM software program whenever they wish to review a patient's monthly updates or review remote patient monitoring results. The process simplifies providers' access to information by avoiding the need to hop between two software platforms. So it's been a great relationship, and there's an awful lot of ease of use working with MedEnt and their CCM initiatives.
Yeah, I think that's key. What you said is, sometimes with some of these other, platforms, you're having to hop between platforms and having to learn another platform. And I think that's key here is that, everything can be done right in MedEnt. So there's no need to learn, another platform here, which can seem overwhelming for providers. Who I always say providers didn't go to school for technology. They went to school to help their patients. And so
That's
I
for
think
sure.
the fewer platforms they have to learn, the better, right?
That's for sure. Yeah,
Yeah.
that has been a big challenge for doctors, and we get that asked all the time. Do we have to hop between programs? And working with MedEnt, it couldn't be any easier.
Yeah. Now, how do you see CCM evolving in the next 5 to 10 years? Are there like new innovations that are coming, or what do you think is going to happen?
Well, CCM is only going to grow with the advancements of AI, which everyone hears in the news pretty much on a daily basis these days. Between AI, remote patient monitoring, and telehealth, we're going to see even more personalized and proactive care models. I also expect to see a greater emphasis on preventative care, social determinants of health, and integrating CCM into value-based care initiatives. The goal is to continue shifting from reactive to truly proactive, patient-centered healthcare. I think that's the direction we're going in.
Yeah, and I mean, I think that makes sense. I think the answer, like you said, is going to be it's going to expand. Just beyond patients who have maybe chronic conditions to getting, like you said, proactive. Which I mean, I think that's the way to go. Now, no, what advice would you give to healthcare providers who are considering implementing these programs?
Well, my suggestion would be start as soon as you can. CCM isn't just a new revenue stream opportunity. It's really a game changer for the patient care. The key is to partner with an experienced team that can handle the heavy lifting from onboarding patients to compliance to monthly patient engagement. If a practice is worried about the workflow integration, they really shouldn't be. Uh, MDSS makes it as seamless as possible. The sooner you start, the sooner the patients will see benefits. My suggestion is you get provider buy-in and support for the initiative, and be prepared to educate your staff so they can speak intelligently about CCM if a patient has a question. Your staff should really know their CCM team members as well who are contacting their patients. And lastly, I would say remember the MDSS team here are the experts, and we're there to help our clients through the process from start to finish. So ask away if you have any questions or concerns.
Yeah, and that brings me to my last point here is how can providers learn more about MDSS? I'm guessing you guys, have demonstrations you can do, and I'm just wondering how can people get a hold of you? What's the best way?
Yes, we'd love to connect with anyone who has interest in CCM or RPM. Providers can visit our website, which is mdssonline.com, no hyphens, again, mdssonline.com. They can call us for a consultation, or which our number is on your website, I believe, or schedule an online presentation. We're happy to walk through how CCM can fit into any practice and happy to answer questions you have. We look forward to working with practices looking to implement CCM and RPM as additional tools to expand their patient care services.
Great, yeah, and you know what? And if folks are also interested, you can always submit an online support request with MedEnt using our online support feature. Just fill in your request and ask to learn more about MDSS. I'm sure we can always help you guys get connected as well. Um,
I'll provide one last thing as my number, which might be
sure.
helpful. I'll leave my number is 813-493-4321. Again, 813-493, and then a countdown, 4321. And we look forward to hearing from anyone who's interested in our services. Thank you so much,
Yeah.
Megan, for the opportunity to speak with you. And this has been exciting for us to do our very first podcast ever.
I
Thank you.
know, your first podcast ever, and it went great. So, yeah, no, thank you so much for being on with us today and talking about chronic care management and RPM. And yeah, we look forward to continuing our partnership, and hopefully we can get you on one of our webinars here one of these days as well.
I'll look forward to that. Thank you so much, Megan.
All right, thank you, Dave. Have a great day.
You both, you too. Thank you.